What are my best tips for adult asthma patients? You need to understand how well or poorly controlled your asthma is. So if you are using your blue inhaler, a reliever inhaler, more than 3 times a week, your asthma is not well controlled. We need to improve it. It can be so much better. But the actual tips are you need to make sure that you are using your inhalers correctly. If you have a pressurized meter dose inhaler, which is where you spray it and it goes psst, then you need to use it with a spacer. If you're doing it straight into your mouth, I guarantee you're not getting enough medication into your lungs. Use a spacer. If you're using a dry powder inhaler, make sure again you have the correct technique. You breathe out all the way first before you breathe in. It's not a quick, short, sharp inhale. It's a prolonged inhale, which then you want to hold your breath for as long as you possibly can, ideally about 10 seconds. You want to make sure that you are using your preventer or maintenance inhaler regularly. Now, if you've only just been started on them, so a brown inhaler or even a pink inhaler, so combined inhaler, you may not see the full benefit of it for 6 to 8 weeks after starting it, because that's how long it can take to reduce the inflammation in your lungs and prevent you from having asthma flares. And once you feel like you're getting your asthma under control, don't just suddenly stop using your inhaler. You have to continue it long term. And finally, identify your triggers. Make sure you know what makes your asthma flare up, what makes it worse, and then try to either avoid those triggers or reduce your exposure to them as much as you can. Send this to someone who has asthma.